Hello, everyone. We are starting our today's webinar. So I can see the room being filled with participants right now. So welcome, everyone. Okay, welcome, Thomas. Welcome, Artem. It's good to see everyone. We will wait a couple more minutes so everybody can enter. Meantime, couple of things that we usually remind you during the webinar. So just so you know, there is a chat window where you can write down, and you could write it down right now, where you're from, why you're here at the webinar, or just say hi. So feel free to use the chat window, and please let me know if you can hear me quite okay. Can you see me quite okay? This will be very helpful as well for myself to know that everything is also correct from the technical point of view. Also, there is a Q&A where you can put your questions and answers. Thomas already used this option to do that. Also, let me know if the chat is working. So write down something on the chat, and then I will be able to see if we can see your questions or the way you say hi. Okay. Okay. Let me know on the chat if you're able to. Oh, chat is inactive, you say. Okay, so let me double check. Okay, now is this better? Could you? Yeah, perfect. Thank you so much, Thomas. Perfect. Okay, and could you confirm one more time the voice, the sound? But if we're good, then we will start. Thank you so much for the feedback. Perfect. All right. So going to our today's topic. One more time, right? Yeah, right down where you're from, and if you're a physio or if you're a distributor, this will also be very helpful for me to know which topic to focus on. Perfect. All right. And I also prepared the presentation for today, so I think we would be ready to start with that as well right now. Good. And also I will share my screen. So let me know if you're able to see my screen, and we're ready to start. All good. Perfect. Good. So today the topic of the webinar is the functional electromyography triggered electrical stimulation. Mostly we will focus on the upper limb. And the reason we're doing that is obviously, and a lot of you know us personally, is because we are developing the EMG-triggered physiotherapy here in Exotech. So just to give you a quick overview on who we are, if you haven't met us yet, and we always invite you to come and visit Poland and take part in our education programs. But for you guys, for the one that don't know us, we are a manufacturer of rehabilitation robots, and we are located here in Poland, in Gliwice, and the company was founded in 2013. And we are happy to announce you, for also the ones that don't know, that we were recognized as the fastest growing company in the Central Europe in the health and life science, and the second fastest growing company in Poland. So we already have over 50 people here in Exotech, in Gliwice, but also in Hong Kong, in Germany. Hi to the German team. And we have trusted customers all over the world. Over 200 clinics already work with our robotic devices, so it's really good to know that whatever we develop here, you use, and the patients are getting better. And the goals of today's webinar is to get more insights into what is EMG-triggered electrical stimulation. Do we act on neuroplasticity, or do we focus more on structure? Is it effective for patients? And how to start, how to work with the patients with the functional electrical stimulation. So to discuss what is it and how is it triggered by EMG, we need to start with basics, right? So we will need to look into the EMG in neurorehabilitation. How do we use that? So basically, as you all know, the EMG records the potential from the muscles, the activity of the muscles, and can be used for assessment, but also for a therapy for the training. And here's the quick example of how the EMG can be used also in the clinical practice to look into the activity of the patient. Even if we are working manually, then EMG can be useful for this as well. And here on the video, actually, we have a physio that is using our robotic device, Luna EMG, for the EMG assessment. So having the EMG in rehabilitation, we also can use electrical muscle stimulation, also with the neurorehabilitation with neuro patients. And to do that, we will use the electrical stimulation to induce the contraction of the muscle. And just to also give you a little bit of the basic information here, how do we look into the parameters of the electrical stimulation? So we do have a contraction, we do have a break in between, but also we will have the frequency, which is how many impulses there is in 1 second. We also going to look in the pulse wide, so how wide, how long is the impulse, and the obviously the increasing the amplitude of the electrical stimulation current. Okay, so let's look more deeply into those. So intensity. Electrical stimulation will engage motor units. It will do it a little bit different than the normal contraction, because the normal contraction usually starts with engaging the slow motor units. And electrical stimulation will start with the fast fatigue motor units. Because the type 2 motor units have a lower excitation threshold than the type 1. And we can, by using the electrical stimulation, change one into the other. So this is important during the rehabilitation process, because we often see the changes of the fibers, and this is how we can control also that. And now I'll tell it a little bit on the other slide. So if we see that the contraction is getting less intense, then we should also give some time to rest for our patient. Let's not work only on intensity, and so it's not our only parameter, because we rather avoid really high intensities. The second parameter would be the frequency, and the low frequencies are usually used for the relaxation, increased circulation, oxidation, and then we go higher, and then we can work on the muscle endurance. Then with the medium frequencies, starting to increase the strength. And here is the 35 Hertz, which we will actually use for our functional electrical stimulation. And the high frequencies, which work more on the muscle strength, mass volume. And the third parameter, last but not least, will be the pulse width. And here the differences are that small wide impulses will be better for smaller muscle groups and feel less intense, but better tolerated. Then the medium one, which we use the most often, are the stronger contraction, recruiting more motor units. And the third, the higher wide, will be more deep and good for larger muscle group. What does it mean? It means that if we are increasing the intensity and we see that we increase and we don't get the contraction that we would like, then we can try to change the pulse width for a longer one, and then we will be able to decrease the intensity. And so we have the EMG, right? So the patient needs to initiate the movement, and then we have the electrical stimulation that goes into the sequences and creates the functional movement. So we put all those stuff together, so EMG with electrical stimulation. And the question that arises is neuroplasticity or structure. Where are we helping our patients with that? And how does it look like in the research? So basically, you probably are familiar with the term neuroplasticity. So this is the ability of the nervous system to respond to internal stimulus and to be able to reorganize the structure. So there are ways that the central nervous system is working here, right? So it can be through sprouting or unmasking, and this graph is quite nicely showing the difference between that. So we do want to influence the process of neuroplasticity also by functional electrical stimulation, and we want to engage the patient here with the more repetition, with the fact that the patient is really engaged into therapy. And there are actually studies that confirms that EMG-triggered electrical stimulation in the upper limb is effective, and it influences the activity of the brain. So those studies were done like through 8 weeks and on 9 patients after stroke. And it was along with task-oriented tasks. So what they've seen eventually that you can induce additional recruitment, but also increase the synaptic performance. So this all influence the upper limb function, especially after stroke, among patients who are like from mild to moderate state. And also the improvement has been has been seen through the tests. So for example, ARAT tests. So here we were able to see the increased activation of the cortical stability. So this all leads to the patients who could partly contract the muscles, but were not able to activate them right. So the functional electrical stimulation induced by EMG leads to the improvement among function, but also the sensomotor areas were more engaged. And so the question, neuroplasticity or the structure, so again, the answer is both, right? So through the electrical stimulation, we can convert the type 1 fibers to type 2 fibers. I mean, we can reverse this process, we can reverse this process because this process often happens after upper motor neuron. And we want to reverse that, and the study shows that this is actually possible. And also through the fact that the electrical stimulation activates more motor units than normal contraction, it can lead to the higher increase of the muscle force. So knowing all those things, we know that we can use electrical stimulation in working with the structure to prevent the atrophy, improve the muscle tension, increase the range of motion, the muscle strength, even the reduction of spasticity, and we want to stimulate towards function. So again, this is something that we always point out in Exotech when we're working with our systems, that working on the function and structures leads to better performing the activities, and this is supposed to lead us to better participation, right? Because always the goal of the patient will be rather among participation, things like, you know, to be part of the social life or be able to function in the society, function on every day. But to get there, we need to kind of break the problem into pieces and address it with technologies in our case. And what the studies is telling us about the efficiency among the stroke patients. So in regards to functional electrical stimulation itself, there is a lot of studies that are discussing different things, like how long should the functional electrical stimulation be provided. So it's between 20 minutes, but up even to 6 hours. There is the between 2 to 7 weeks. So all those different approaches, protocols were assessed with different parameters, but just with the fact that it was done through the functional electrical stimulation. And when we look at the summary of the studies, we see that most of the cases favored the experimental, just in one case was like not like more in between. So what we can say is that the functional electrical stimulation among stroke patients is more effective and can be more effective than the training itself. And so the conclusion suggests that functional electrical stimulation should be used in the neurorehabilitation to increase the ability to perform the activities after stroke. But what about the EMG fast? So there's also a systematic review here, and it points out that EMG-triggered electrical stimulation may be even more effective than functional electrical stimulation, and improves activity after stroke, facilitates the achievement of hand function. So it proved to be effective among stroke patients. And definitely is even more effective when we are combining everything together with the motor tasks. And how are we doing this, right? So we know that it's effective. It should be implemented among stroke patients for upper limb recovery. So how to do it in practice? So what we did, we implement the programs of into the software, and we provide the pre-programmed parameters for activities like opening and closing the hand, grasping the objects, putting the hand to mouth, or the arm extension support during the transferring. We also have like an open program out there where we can choose by ourselves which muscle is triggering the electrical stimulation and how many muscles, so we can be more creative here and provide our own program to the patient. So just to give you the overview also of those specific programs, here we have the hand-to-mouth electrical stimulation. So the patient is activating the limb, and the functional electrical stimulation is helping with the movement, right? So that's the best to try on yourself. So I especially like in encourage you to get device and test it as well, because the electrical stimulation here can really lead the movement, right? So it can actually get you your hand to the mouth, and by supporting through electrical stimulation. So another program that we have is the open and close program, and it's about the hand is first opening, right? So it goes into the extension of the wrist, and then we have a small pause, and then it goes to flexion and the opposition of the thumb. So basically you could see on the screen that there is the activity out there that patient needs to provide. And if the patient goes above a certain threshold, then we end up with the functional electrical stimulation. So step by step, the hand will contract in the pattern. The same application of the electrodes can be done in the next program, which is called, let's go back. It's called grab and release. Okay, yeah, we're here. So the same situation comes here. The patient needs to activate the movement. Then there is contraction of the muscle. So we go to the extension, and during the extension, there is a flexion of the hand. So, and also the opposition of the thumb. So patients are working actively to provide the movement. And the third program, the fourth program, is the arm support. So patient is trying to stand up, and the activity, the electrical stimulation is supporting this affected hand. Because we are working more on the triceps here. So let me show you, right? The triceps, the forearm. So based on the 3-channel electrical stimulation, it will help patient to transfer from bed to the chair. So this is how we can train. Okay, and also we already have some process into the therapy. So we are working through with our patient based on the previous results. We are working with our patients, and we try to provide the best therapy. I mean, those are the clinics that are using the Stella Bio device in this case. So here there's an example of the post-traumatic discopathy, C4, C5. And they were working through both EMG and electrical stimulation on the grasping and with the hand. So here you can see they were working with the EMG biofeedback on the hand extension. So that's the EMG biofeedback. The patient is working, seeing the activity on the screen and trying to increase the movement. But also the other program is the one that I mentioned you already. So this is the EMG combined with the electrical stimulation, right? So the patient also needs to be active in the wrist, and with activity, he is able to move through also the support for electrical stimulation on the forearm. So those are the videos that we get from the clinics when they wanted to share the process, and they tell us that it's a tool that helps them trigger also the nervous system to give more stimulus to the patients and keep exercising. A lot of repetition can be done here. Also, there is the usage among kids. We didn't expect this to be this successful, but the clinic is, for example, having a patient here with some not specified hemiplegia with the patient. There was like no activity in the muscle, in deltoideus muscle. And so they start with the electrical stimulation first of the deltoideus. And also you can see it on the screen, so you can combine it with the exercises. Yeah. So also the patient know exactly when the contraction will come up, and also physiotherapists can look at the screen. And the same patient here in the abduction, also having some electrical stimulation. The physiotherapist is observing the screen. And what they did with this patient, they assessed it with the EMG at the beginning, and there was no activity in the deltoideus muscles. And now there is activity, the beginning of the movement. So they expand for more and more with the games, with the EMG biofeedback, but they even saw the improvement after a week and a half of the joint stabilization, the awareness of the movement, and the muscle activity appearing comparing to the previous no activity. And so, like, as a take-home message, we could say that electrical stimulation with EMG facilitates motor learning, increase the range of motion, muscle strength, and core muscle activity. There is the positive control effect of motor control, as opening the hand, grasping, gripping, more cognitive engagement during the EMG-triggered electrical stimulation comparing to the just functional electrical stimulation. And we can increase the intensive training through reducing the participation of the therapist, but engaging a patient even more. So the last question is, how can the clinic start? From our case, we provide the device. It's a 4-channel surface EMG electrical stimulation with additional 2 channels for pelvic floor electrical stimulation or EMG. And there are batteries in the system, so you work like wireless, and you actually using Wi-Fi, so you can put the device on the belt and walk around, mix it with different functional tasks, so you're not really stuck to the device. You can really walk around. There is a way that we can use tablet or laptop, so you can choose out of those 2 options. And there's obviously the software, and there are packages of electrical stimulation electrodes and EMG electrodes. So when you're set, ready to go, you can start right away in your clinic or with the clinics that you cooperate with the system, and use this in everyday life, using EMG for assessment treatment, electrical stimulation for treatment, and combine both. So EMG induced electrical stimulation and EMG functional electrical stimulation in the patterns that creates the movements, in this case, the upper limb electrical stimulation. Okay, guys, so that was the knowledge that I prepared for today. And so I will now look at the chat and see if you have any questions. You can put it both into the question and answer or to the chat, whatever is comfortable for you. So if there are any question that comes to your mind, just let me know at this part. Okay, the question from Thomas is about implementing electrical stimulation in our other device in robotic system. Well, it's a case that we are wondering about, but for now, there are clinics that are using Stella with Luna as well. So by combining those two devices at the same time, they are already doing this. It might be a little bit tricky maybe with the timing, but it is already possible. And also interesting thing is the functional electrical stimulation of the upper limb that can be done in the pattern like this, right? So not something that is easily done on Luna. So it's good to have also a separate session with Stella to provide more functional upper limb training basing on Stella, right? And on Luna, it would be more of the assistive movement based on the EMG. And on Stella being supported not by robotic, but by electrical stimulation. I think that even splitting those two sessions can provide more and more repetition for a patient. Okay, there are questions about the presentation. Yes, of course. Please write me down on my email. You can see it not anymore on the screen, but maybe one more share of a presentation. Okay, and you can see my email address on the screen right now. So if you want me to send you the presentation, please write down an email out there, and we will send it out. Also, this webinar is being recorded, so you will be able to look it up later on as well. We will send it to every person who sign up for the webinar. Good. Perfect. Thank you, Thomas, also for coming in. Good to see you. Yes. Well, not exactly. It's Anna. Anna, let me write it down. Puświata, my email address, exotech.com. Okay. Yeah, now it's perfect. Perfect. All right, there it is. Good. Any other question? Oh, good to see Keith here. Yeah. Okay. Singapore. What time is it in Singapore right now? And United Emirates. Perfect. Good to see that everyone comes from a different places, and we can see that there is, oh, Taiwan. Good. Wow. All right. Any other question? There is a hand raise also for Manish. Manish, if you could write down your question on the chat or on the question and answer, this would be also great. Okay, oh, thank you for this. Opinion Stella is very handy and useful. Yeah, we are very proud of Stella, and we get very good feedback from the customers and how they feel the current, how they feel the programs, because what we were really trying to do was to create the most sensitive EMG device, and it really is sensitive. You will see this by yourself if you will try. So I would suggest for you to reach out to us directly. How can you get the device for tests? We'll be very happy to cooperate in that matter. And because we were trying to create the most sensitive, but also the electrical stimulation is very, I would say, clean. Our engineers tried that the signal is very pleasant for a patient, and we see great improvements. What is the minimum and maximum microvolt to perform the EMG-triggered functional electrical stimulation? I'm not sure if I understand the question right, but we are increasing the intensity between 0 and 100 milliamperes. And this is, but most of the time we're not exceeding 40. So we are trying to work among this with the parameters that are implemented in the program. And this is most cases a successful functional electrical stimulation. So I haven't seen patients who would go over 40. Well, 50 would be like a maximum, totally not going over. Okay. Or if you ask about microvolts, then it's also something that we can adjust, right? So I've seen patients using very small activity. For example, 6 microvolts, 5 microvolts is already a good EMG activity to start functional electrical stimulation, because the basic activity of the muscle is 2 microvolts, right? So we need to go above those microvolts. So 4 or 5 would be already okay to get the threshold out there and to start the functional electrical stimulation. So even for very, very weak patients, yeah, I think this would probably answer your question more, right? So very, very weak patients can start. Well, the maximum microvolt is, you know, there is no maximum, like there can be 500 and more, but we are the one that are setting the threshold for a patient, right? There's automated calibration out there. So we ask a patient to contract, and then the threshold line is on 50% on what the patient is able to do. But during the program, we can manually change that. So if we see that our patient is getting tired, we also can lower it down a little bit. Or if we want to challenge our patient a little bit more, then we can go up with that. So it's still a tool for a physio who wants to provide a therapy, and he needs to be, as usual, the brain of the operation, and the tool will provide the reading of the EMG, but also the electrical stimulation, of course. All right, if there is no other questions, one last chance to come up with anything that comes to your mind. We would be slowly finishing our today's meeting. I think that the takeaway message from today is that we have a very effective tool of the EMG-triggered electrical stimulation that is proven through multiple studies and reviews, that I think we don't use as often as it could be used. Like, for example, in Poland, the electrical stimulation sometimes is treated like something for maybe sport patient or orthopedic patients, and not that often for neurological patients. And again, what we see in our experience, that it can be really, really useful, helpful, and provide a new stimulus for a patient. Also the one that is in the therapy for quite some time. And we can get some new results that we didn't have before. And also for all those clinics who already are using the Luna device, this will add some additional functional treatment to the patient, and this treatment will become more and more effective. Great. All right, guys. Thank you again for being with us today. We will try to bring you more of the information in the next webinars. You know, stay tuned with us. EMG, electrical stimulation, robotics. This is something that we are passionate about. So we will try to bring you the latest research and provide you with the best tools. Get in touch with us, write me an email, and let's cooperate. Let's make patient progress, patient physiotherapy even more and more effective. All right. Thank you so much. Have a wonderful day. Talk to you next time. Bye-bye.